Om Dham Dhanvantare Namaha. Karpuragauram Karunavataram Samsarasaram Bhujagendraharam Sadavasantam Hridayaravinде Bhavam Bhavani Sahitam Namami. Let me share. Topic is Patoladi Kashaya clinical indications. So in Ayurveda, so many kashayas have been mentioned and it is used in the management of various disorders. Now, Patoladi Kashaya is one such preparation which is used in general practice. Kashaya formulations are commonly used in the management of both acute and chronic debilitating disorders by Ayurvedic physicians in Indian subcontinent. Kashayas like Amritottaram Kashayam, Maharasnadi Kashaya, Mahamanjishtadi Kashaya, Mahasudarshana Kashaya, Trifala Kashaya, Patoladi Kwatha, Panchagita Kashaya, Patoladi Kashaya, Guduchi Kashaya are few formulations which are frequently used by Ayurvedic physicians. Patoladi Kashaya is one such preparation which is commonly used in the management of Pitta disorders. So diseases like Amla Pitta, Parinama Shola, Annadrava Shola, non-ulcer dyspepsia, hyperacidity syndrome, peptic ulcer, duodenal ulcer, gastric ulcer, and chronic gastritis are few indications of Patoladi Kashaya. The ingredients of Patoladi Kashaya are having the actions like Pittahara, antacid, Shotahara, Shulahara, Amapachaka, Tiktarasa Yukta, anti-inflammatory, ulcer protective, soothing action on the mucous membrane, and Vatahara actions. The present paper highlights about the clinical indications of Patoladi Kashaya in an experiential and scientific view. So, Patoladi Kashaya is a decoction of Pittahara and Tikta Rasayukta drugs like Patola, Nimba, Vasaka, etc. These drugs are having actions like Pittahara, Tikta Rasayukta, Deepana, Amapachana, Trimigna, Virechana, Malavatanulomana, antacid, cytoprotective, anti-ulcer, Shulahara, Runaropana, soothing action on the gastric mucosal cells, anti-infective, antibacterial, bactericidal, anti-inflammatory, Pitta Virechana, hepatoprotective, hepatic stimulant, and immunomodulator actions. It can be effectively given in Pittaja and some gastrointestinal tract disorders. These are having these least adverse drug reactions after the administration of Patoladi Kashaya internally. So ingredients of Patoladi Kashaya are Patola, it is Trichosanthus dioica, Haritaki, Terminalia cebula, Vibhitaki, Terminalia bellerica, Amalaki, Embellia officinalis, Nimba, Azadiracta indica, Karanja, Pongamia pinnata, Guduchi, Tinospora cordifolia, Dhavani, Solanum indicum, and Vasa, that is Adathoda vasica. So this is Patola, Trichosanthus dioica. This is Tiktarasayukta and Pittahara in action. This is Nimba, Tiktarasayukta, Trimigna, and Pittahara in action. This is Haritaki, Sivirechana Anulomana, Kashaya Rasayukta, Pancharasayukta, and it is Tridoshahara. Vibhitaki is Kashaya Rasayukta, Tiktarasayukta, and Tridoshahara and Vedani in action. Amalaki, Ambelica officinalis, contains natural vitamin C and it is Rasayana in action. Vaistapana also. Vasaka, Adathoda Vasaka, it is Tiktarasayukta and Pittahara in action. Guduchi, Tinospora cordifolia, a best immunomodulator drug, hepatoprotective, hepatic stimulant, and Tiktarasayukta drug, which is hypoglycemic also in action. So this Patoladi Kashaya is having action on liver. It is best hepatoprotective also. This is the histology of the liver. You can see in the central vein surrounded by hepatic lamina concentrate surrounded with the hepatocytes, epithelial cells, and in between there are sinusoids and very canaliculi. So this is Patoladi Kashaya action on the liver also. This is the duodenum. So in hyperacidity, there will be ulceration in the duodenum known as duodenal ulcer. You can see this is the histology of duodenum having the villi and in submucosa, Brunner's glands are there. So in duodenal ulcer, hyperacidity will be there, causing discontinuation of the mucosa, and there will be ulcer. This is the stomach body, stomach histology. So you can see the gastric pits. The mucosal cells secrete mucus also, and gastric pits or gastric glands secrete pepsin and hydrochloric acid. Oxyntic cells secrete hydrochloric acid, and chief cells secrete the pepsin. So in gastric ulcer, there will be discontinuation of the gastric mucosa, which is cleared by Patoladi Kwatha. This is the tongue. Patoladi Kwatha is Tiktarasayukta. It is Swayam Aruchi, but it relieves Aruchi, Aruchi Nashaka. So these are the taste buds. You can see they are the taste buds, the valid papillae. Valid papillae in that printed taste buds are there. There is something for taste. So Patoladi Kwatha removes Aruchi also. So actions of Patoladi Kwatha are Pittahara, Tiktarasayukta, Deepana, antacid, hepatoprotective, hepatic stimulant, Pitta Virechana, Koalagog, Virechana, Pachana, Crimigna, cytoprotective, antihistaminic, sympatholytic, anti-infective, antibactericidal, antibacterial, and immunomodulatory actions. Now let us see the clinical indications on the basis of experience and also textual reference. We have following indications for Patoladi Kwatha, like Amlapitta, Parinamashola, Annadravashola, peptic ulcer, Uddarakrimi, Pittajatsara, Kamala, viral hepatitis, non-ulcer dyspepsia, hyperacidity syndrome, chronic gastritis, acute gastritis, arochaka, anorexia, agnimandya, indigestion, ajirana, alcohol liver disease, alcohol hepatitis, and cirrhosis of the liver. Now, with different disease-specific adjuvants, it can give in various type of disorders. There is an Amayika Prayoga. Patoladi Kwatha is given Amlapitta with the Sutashekar Rasa and Pravala Panchamrita Rasa. In Parinamashola, it is given with Agnitundivati and Mukta Panchamrita Rasa. In peptic ulcer, it is given with Agnitundivati, Pravala Panchamrita Rasa, and Avipattikara Churna. In Uddarakrimi, it is given with Vidangarishta and Krimimudga Rasa or Krimikuthara Rasa. In Pittajatsara, it is given with the Puttajagana Vati. In Kamala, jaundice, it is given with Godandivasma and tender coconut water. In viral hepatitis, it is given with Argyrodinivati and Godandivasma with the tender coconut water. In non-ulcer dyspepsia, it is given with Agnitundivati and Lavana Bhaskara Churna. In hyperacidity syndrome, it is given with Avipattikara Churna and Kamaduga Rasa. In chronic gastritis, it is given with Avipattikara Churna and Mukta Panchamrita Rasa. In acute gastritis, it is given with Madhipal Rasayana and Lajamanda. In Arochaka, it is given with Lashunadi Vati. In Agnimandya, it is given with Hinguvashtaka Churna. In Ajirana also, similar medications. In alcohol liver disease, it is given with Khajurajamanta, Aragyavardinivati, and Pranamadi Munduram. In alcohol hepatitis, it is given with Gudichi Kashaya and Aragyavardinivati. High carbohydrate and fat-free diet is given. In cirrhosis of the liver, it is given with Aragyavardinivati, Pranamadi Mundura, and a high protein diet. Coming to discussion. Patoladi Kwatha is usually given in Pittaja and gastrointestinal disorders. It contains bitter drugs which are having Pittahara and antacid properties. The ingredients are having reactions like Pachana, Deepana, ulcer healer, cytoprotective, Rasayana, cholinergic, sympatholytic, antihistaminic, anti-infective, anti-inflammatory, antibacterial, bactericidal, anthelmintic, crimigna, hepatoprotective, hepatic stimulant, Pitta Virechana, and immunomodulator actions. So it is commonly given in GI disorders like Amlapitta, Uddarashula, Pittajatsara, duodenal ulcer, gastric ulcer, non-ulcer dyspepsia, hyperacidity syndrome, chronic gastritis, and worm infestation. It has least adverse drug reactions even after prolonged usage. But due to bitter taste, it is not palatable, sometimes in children especially. With suitable adjuvants, it can be effectively given in various disorders with good outcome. Coming to conclusion, Patoladi Kwatha is a formulation with bitter drugs as ingredients and is usually given in Pittaja and gastrointestinal tract disorders. There are least adverse drug reactions even after prolonged usage of this formulation. And with suitable disease-specific adjuvants, it can be effectively given in various disorders. So these are the references. So, Patoladi Kwatha is usually given in pitta disorders, gastrointestinal disorders like Amla Pitta, Aruchi, Agnimandia, and pitta disorders like duodenal ulcer, gastric ulcer, etc. So, it is a yes. So, thank you for patient hearing.